is Jessica. I'm 27 years old. My disease, there's quite a few. Stroke, factor V related, which is a blood clotting disorder, diabetes, diabetic retinopathy, and low vision and blindness.
I'm Tracy Toller, I'm 37, and I have lupus and lupus nephritis.
I'm Kaylee Martin. I'm 29 years old and I'll be 30 in October. I have Huntington's disease.
My name is Ann Wasmer. I'm 48 years old and I have end-stage renal disease.
My name is James. I'm 43 and I have cerebral palsy.
My name is Kalila. I'm 23 and I am an asthmatic with chronic costochondritis.
Hi, my name is Julie Hoyer. I'm 49 years old and I've been living with degenerative disc disease.
My name is Valerie Nichols. I'm 26 years old and I have rheumatoid arthritis.
Before I was diagnosed, I was in a master's program at Syracuse University. I was getting my master's degree in marriage and family therapy. So I was taking classes and doing well. I saw clients and actually gave them like diagnoses and stuff like that. Like a psychiatrist would have to sign off on it, but like it was pretty like high pressure stuff. Actually, part of me wasn't happy, but I was completing a lot of things and doing them well. It probably started earlier than when I realized it's starting, which was in the fall of 2011. But I just had the most difficult time completing my paperwork. I could still see my clients and do that okay, but I could not get my paperwork done. But by the winter, by January, I was deciding I can't do this. I didn't really know that it was Huntington's disease at the time. I just thought it was stress, I guess. I don't know, because I didn't realize that it was Huntington's disease.
Let's see. I was diagnosed with lupus when I was 17, and it's pretty much it's changed my life.
I had 3 strokes altogether when I was 25. And it's definitely done a 360 on my life.
I think that for a while, it was probably about a year of a struggle trying to find my equilibrium, trying to create a balance, trying to do the things that I've always done, and then suffering with a lot of pain as a result of that. So I think this year especially has been a process of acceptance and just shifting my perspective and learning how to do things differently and how to let go of things that I've always done in the past.
Well, it started actually happening when I was 23, shortly after my father passed away. And I wasn't sure if it was like a mind-body thing, like I was mentally creating something out of the stress and lack of ability to process what was happening.
I was 11 years old when I was diagnosed. Now you're 11, at least in my case, I kind of did what I was told. I was very close to my parents and they were great about, getting to me to doctor's appointments. So for me, I almost feel like I've had this all my life, even though, you know, I was very healthy before that time. As an 11-year-old, you know, your big thing is going out to play. And
I was diagnosed as asthmatic when I was around 7, maybe 8, I want to say. The costochondritis didn't hit me really until my teenage years. So by that point, I had already, you know, learned how to control the asthma, and I was like, okay, I've got this under control. I've learned what my triggers are. You know, I'm handling this just fine. And then suddenly this new thing hits out of nowhere. And it's like,
probably the biggest change that I've had is that I've had to rethink my career. I've been a hairdresser for about 30 years now. I love it, and it's been a great career. However, at this point, I've had to moderate my life a little bit to try to manage it.
Well, it didn't affect me. It just, I do things differently. Yeah, I do swimming, I do skiing, and I did all types of things that a normal person might. It's easy for me, but I just do it in a different way.
About 3 months after the strokes, that's when I found out that I had the factor V lead in the blood clotting gene. That was one of the major contributors to my strokes. Probably about 6 months after the strokes, we found out about my diabetic retinopathy. Unfortunately, it had gotten to the point where I've had to have 3 laser treatments and 5 eye surgeries, which has left me blind in my right eye and with low vision in my left eye. I wasn't able to drive before the vision piece, with me just having the stroke and everything, and you know, of course I was ready to drive and everything, but then with the vision piece, I haven't driven in over 2 years.
It affects me day to day in every way. It's gotten worse over time and only just started getting better. But I mean, my grip on things, really simple things can be difficult sometimes, like changing clothes and just opening things, shutting car doors. I used to do yoga a lot. I used to do physical activities a lot. And there are certain things that I'm just not capable of doing. Even if I pushed myself and was like embracing the pain of it, my body would reject it. So things like the downward dog pose, I can't bend my hands back that far and put weight on them.
I was able to get a transplant, and along with, you know, the end-stage renal disease and the medications, you do get some other diseases along with it, and that includes osteoporosis. I've since gotten diabetes in the last 3 years from being on steroids for, you know, over 30 years, so that'll affect that. I've had some skin cancers. Every time I go in, they usually find something, and we just, you know, try to take care of it and move on from there. I'm trying to think, you know, then there's some other things, just like high blood pressure, high cholesterol. Recently with a new medication, well, it's not that new, it's since 2003, I think. We had to switch over to a different medication because the other one was hurting the kidney, and that one has caused anemia as well as the high triglycerides. So, you know, you start out with 3 or 4 medications and you end up with 20. So it all depends on what's going on. For the side effects with the osteoporosis, that was a big thing because I was 22 and suddenly I had this vertebral fracture, and it was probably, you know, some of the worst pain I've ever had, and it's not something I really thought about because of steroids, which I've had to take since I was 11 years old. That is what has caused a lot of these problems. And I knew that every once in a while they would take an x-ray and check things, but I don't know if I just never understood it because I started having this disease so early in life that I didn't really think about it, or if it was never explained to me, or maybe it was explained to my parents and I never, figured that out. But that was a big surprise. Once I had the kidney problems, in the beginning we couldn't go anywhere because I needed to be on dialysis, and you're doing that 3 times a week, 4 hours each time, or for some people it's less now, but you have to take those things into consideration. So being on dialysis is probably the most difficult thing about this disease because you're kind of stuck. You have to do this to live, and you have to schedule everything around it. It takes precedence over everything. Once I had a transplant, that changed everything for me. I've actually had 2 transplants. The first one was in 1979 when I was 11. I only had to be on dialysis for 3 weeks, so I was lucky. As a child, you're at the top of the list, and you get it right away. It was 1992 when that kidney failed, and I had to be on dialysis for 4 years. I had asked my brother to be a donor. I didn't, do it very gracefully, but I did ask him, and about a year later, he said, let's do this kidney thing. At the time, I didn't think he was going to do it, so I was kind of like, well, what kidney thing? What are you talking about? But we did end up, he ended up being a perfect match.
It's changed my life dramatically. I've had to learn to adjust on how I manage my life with daily activities and what I eat and where I go. So it's been difficult these last 20 years. And right now I'm going through a flare-up. And a flare-up means that I'm fatigued. It's hard to get enough sleep at night, and it's just it's hard to live. And those that have the disease understand what I'm going through. And those that don't, it's very difficult. So
when I did see a doctor and when I did finally get the blood tests after months, it was both helpful to have the label and something to look at, and also really disheartening to be like, this is something that is chronic, that is not treatable, that's not something I've ever had to deal with before.
Once I finally did get tested though and found out my results, I felt relief actually, because it let me kind of move on with my life.
I felt like I'm almost inhabiting a much older body at times, and that's just affected every aspect of my life. The symptoms I have are joint pains and sometimes nerve pains and inflammatory, inflamed joints.
you can be very fatigued, and you can be you go through stages of depression, and it's almost like going through grief. You go through the stages and you think you're done, and you go back again, just dealing with it.
The main thing is being tired. And I was talking to somebody about that, and they're like, well, I'm tired. And I said, well, okay. I said, I guess it's normal. I said, I might get more tired some days than others. Fluid retention's a big thing with me. That, that's when I remember, one of the things that reminds me of my disease and what goes on in my life and why I have to take these medications. And it's more, the fluid retention's more eating out, getting that extra sodium that, is what does it. but it's that's a reminder of what's going on in part of my life. My biggest problem is remembering to get my blood test done once a month, and that's because I work. And taking medications is easy for me. You get up in the morning, they're right next to the bed, you take them, there's no problem with that.
I remember the first time I got a flare-up, I genuinely thought I was dying, and I was freaking out so badly. Everything, like, it progressed pretty quickly, like maybe in a 30-minute time span. So I had cleaned my room, and I was just, kind of chilling downstairs on the couch, I think, like, watching Monsters, Inc. or something. Like, that was how long ago this was, so throwback. But yeah, I was just sitting there, and I could feel my chest getting kind of tight, but it was, like I said, I had been dealing with asthma forever, so I thought, oh, that's just what it is, I'll just grab my inhaler, and I took that, and I just kind of thought, okay, if I chill out and just kind of sit here for a little while, it's going to pass. And then I noticed the tightness started to turn into pain, and that was what I wasn't used to. And I kind of did my inhaler again, thinking, okay, maybe I didn't inhale fully, and, it just didn't take. And it just kept going, and I noticed that the medicine from the inhaler wasn't working, and it felt like I had about that much room worth of expansion in my lungs, and every inhale and every exhale became excruciatingly painful. And I remember calling out for help, but this was like the middle of the night, so everyone was like dead asleep. No one heard me. I hauled myself up the stairs, and it got to the point where I could no longer speak. So I just started banging on the wall as hard as I could to get my mom and my grandma's attention. And they finally came in, and they could kind of see me. If I was trying to hold my chest, it hurt, but they could see I was kind of guarding this area of my body, so they figured it was something to do with asthma, but they didn't hear me wheezing, and that was what was kind of confusing them. And I remember my mom trying to put her arm around me, and I jerked away from her really fast because it hurt so badly. And, she asked me, did that hurt you? And I had tears rolling down my face, and I was just nodding, and she was like, come on, we're going to the ER. I was having a costochondritis flare up, and what that meant was that the tissues surrounding my rib cage had swollen, but the lining of my lungs had swollen at the same time. And so every time I was breathing, they were rubbing against each other, and there's normally supposed to be a layer of moisture there so that they glide, but that wasn't happening. As that was happening, it also triggered an asthma attack. So not only was that painful, but it was also my lung capacity was shrinking too. So my lungs were basically slowly collapsing.
My situation is such that my L4 and L5 discs are pretty close to being non-existent, and whatever is there is pushing on nerves that affect my right leg. So I've had to learn how to moderate my activities so that I don't get too fatigued. If I do, then first of all, I'm in a lot of pain that goes down my right leg, but also my right leg doesn't work, and I can't lift it, I can't climb stairs, I can't drive. So it's really been important for me to learn how to just moderate my activities and come to a level of acceptance and try to really put my health and taking care of my body as a priority, instead of just taking it for granted that I used to be able to do all the things that now I have to think ahead of time and ask for help for.
I really don't have symptoms. I just, sometimes I feel tired in the legs and stuff, so that tires me out and stuff. Like, I can't walk, so I use a stander and a walker and stuff, so that helps me get around and stuff.
The first symptom to really show is cognitive issues, which are things like processing speed and memory, forgetfulness, and impulse control, and sometimes there's like personality change. I'm trying to like utilize some of the symptoms to my advantage, like things like having less of a filter and less inhibitions, like allow me to talk more to people and be more open, be more myself, and I also get to try more things without fearing that I'm not going to be able to do it perfectly.
On a normal day, I feel almost normal. On a day that I've had activities the day before, I can feel it. My back hurts. My affected leg hurts, which is on my left side. I'm tired. All I want to do is sleep, or something not very active, either knitting or watching Netflix, or just something that passes the time, that I don't have to do a lot of activity for. Sometimes if I'm more tired, my vision kind of wavers a little bit, which is not always the best feeling in the world, because then I stress out about if the vision is ever going to get better. It's definitely emotional because you're not supposed to feel like this at 27. At least I was always told that, until it happened to me. You're supposed to be young and vibrant in your 20s, even in your 30s or 40s, or 50s even. A lot of people don't understand because I was so young when I had the strokes. Usually when you have something like this, you're much older. You've been married for 35 years, or you have your kids already, or you don't have it when you're 25. So people just don't understand. They think after a year or so, I should be better, and I am better, but I'm not who I was 2 years ago. I can't be up all night and be fine the next day. Say, like this past weekend, I went to a concert. Well, that Friday, I really couldn't do anything. And then I knew on Saturday was concert. That was like my big day. And then on Sunday, I was going to be exhausted, which I was. So I always need like a 3-day recoup, or, the day before, the day of, and the day after. I have to block out time. And I also have memory issues, so I don't necessarily always remember to call people or see people all the time. So some people do get offended on that. And with me not being able to drive, I can't see people as often as I'd like to. Yes, they try to come see me, but there's only so many hours in the day. The people that are closest to me, that have seen it every day, they know like little signs on what to do. I do have close friends that say, if you're feeling tired, let me know. But there is still a part of me that wants to be 27 and wants to, do the mile hike or whatever we're doing that day. Even if my body feels not such the same way. But they do ignore it, or they don't talk about it, or just, I should be better.
A lot of times I'm happy about who I am now, but sometimes I worry that I'm annoying people and they're not telling me because I don't know why they're not telling me. I try to make it a point to tell them please tell me if I'm annoying you. But I feel like that hasn't really worked yet. Maybe it scares people. Maybe like the happiness that I have, I don't know if it's sort of naive, like a naive way to live. I can pass like for normal looking, and I can pass for like normal talking to most people. Like I guess I don't think I seem like I really have issues, even if I stammer or like stutter or can't remember my words or whatever, because some people are like, yeah, I forget my words all the time. And it's just frustrating because in my head I'm like, no, you know the word. I wanted to go on dates and not struggle with like telling people and having them like be overwhelmed by what I told them. I have a chronic illness. How do I tell a person? I'm afraid I'll never have a partner, and that's something that I want more than anything. But at the same time, I'm not sure if I want a partner. Kind of recently, I've just been questioning in my head, like, wait, do you want a partner? Like, can you live without, like, mom and dad? Like, not, like, or do you, like, always want to live with them and kind of help them also as they help you? Because you don't want anybody to have to take care of you. It's like, it's a big deal. Like, the person would be honestly, like, taking on the responsibility of taking care of me.
A lot of people to help me, like to push me around and do all kinds of stuff. So,
At first, there was definitely an air of disbelief about it, you know, which I think is common with any sort of, you know, invisible illness. You know, if they can't see anything physical, then obviously it's not there. Or if there would be kind of this notion of, oh, well, she's an actor, you know, she's just being a drama queen, you know, she'll get over it. Or, you know, perk up and you'll feel better. Like, wow, that never occurred to me. Thank you. Just things like that would, it would just kind of get under my skin. And I think it was the third or fourth time I flared up. I think I just like was kind of nagging my grand to take me somewhere because it was hurting so badly, and she didn't understand. And it's kind of one of those things where if you've never felt it before, you can't really describe the pain to someone else. And she took me to the doctor's office, and the nurse kind of looked at me and was asking me what was wrong, but I was just kind of like tunnel vision. The only mantra that was going through my head was make it stop, make it stop, make it stop, somebody please make it stop. And my grandmother sort of answered in my place, and you know, she was like, oh, I think she's having an asthma attack. She's just gotten too worked up over it or whatever. And the nurse asked her, you know, has this ever happened before? And my grandma said, yeah, you know, doctors told her it was this, and this. And the nurse looked at her and went, no, when she told you she's in pain, she means that I have the same thing. Like, when she's telling you it hurts, it is excruciating, like she's not lying to you. And I just looked over at her, and that was the first time I had smiled all day long. I just went, like, someone gets it. Like, finally, someone knows what this feels like. And it's like, that validation was kind of everything in that moment.
I'm very open about my disease and what goes on with me. Usually, you know, the first time I meet someone, often it will come up because that's, you know, part of who I am. So it's not something that I keep hidden. It's different with everyone. You know, with family, I can totally be myself. I was just talking to friends of mine from elementary school, and you know, they grew up with me, so they know what's going on, and I don't have to pretend to be someone else. Not that I ever do pretend to be someone else, but you don't wonder what this person's thinking about you. You know, these are your true friends that stuck around, and they know you inside and out, and it's wonderful to have that type of friendship with someone.
My family and my friends, there's only a handful that I have. My mom, it has been a tremendous help. Um, she she's been there for me, and I know it's hard on her, and I know it's hard on people. Um, it's difficult sometimes to be around people because I sometimes feel like I scare them because you never know when a flare up is going to happen. And sometimes I may have a muscle spasm or I scream out in pain or my arthritis acts up and I cannot move for a few minutes. So you go into a shell and you don't want to be bothered, not even with your family. So you battle depression. So it's difficult. But what I tend to try not to do is close myself in and shut people out because I can do that sometimes. I love my family and friends, but it's been a hard road, and I'm just so appreciative of all the people that's helped me.
A lot of people don't know. A lot of people don't know yet. So I'm in the process of sharing that. And I don't know who to tell and who not to tell. It's always kind of an odd thing. Like if I can't do an activity or a sport or yoga, or I've been eating gluten-free because for whatever reason I find that gluten really doesn't help me, which is killer because I loved mac and cheese and I loved bagels for so long. I've had a family member I've gotten a sense that they pitied me a little bit when they found out, because they just couldn't, I don't know, they couldn't relate to it at all. And when they saw my hands and I explained what was going on, I felt like they were just like, oh, that's awful, and sort of moved on with their daily life, not thinking about it again. And that's fine. I mean, we all do that to some degree. We can't solve all the problems in the world. But sometimes it's really hard if someone doesn't understand what a chronic illness is like, or doesn't have that experience with someone in their own family that draws some sense of empathy and understanding.
I've actually been really fortunate. I have an amazing partner, beautiful children that are willing to help me to do the things that I can't do any longer. Like, I'm lucky that I've been supported by my family, because I've had to ask for help in ways that I've never had to ask for help before. So I find that people are very gracious and very generous in their love for me and wanting to help me to be able to get the things done I need to get done and not suffer in pain at the end of the day. I actually had a real epiphany about a year ago. I was in a wheelchair. I wasn't able to walk. And, you know, it took a lot to try to figure out how to get things done, how to do the things I love to do, how to go to a concert when I couldn't walk for more than 10 feet without a wheelchair. And I learned a lot about the loneliness that a lot of people probably feel being in a wheelchair. I noticed going into stores how people didn't look at me, and I'm actually a pretty outgoing person, but I found that I was ignored a lot when I wasn't walking among, you know, the other walking people, and I I can imagine that it must be a really lonely place for some people, and I'm fortunate enough to be able to reach out myself and engage people, but I've noticed that I have a different perspective now. I talk to people differently, and I approach people more now that have physical disabilities, and I make sure that I do get on their level and I do talk right to them. And so it's really changed my perspective, and I hope that I can share that and will change the world's perspective on dealing with people that are in wheelchairs or using canes. And you know, it's not just, you know, old people, it's people of all ages and all walks of life. And you know, we just really need to be able to make people feel as important as they should feel, no matter what situation they're in.
The first thing that changed was the weight gain. No one told me that when you first get on prednisone that you will gain so much weight, and the side effects that can go with that, which is the stretch marks and the bloating. But I have learned throughout the years, and someone once told me, don't be ashamed of your body. What you have and what you've been through, and those stretch marks are badges of honor. So carry them. So I try to remember that, but still, it's hard when you look at yourself and you look different. So my hair has been affected. I cut all my hair off, and my appearance has changed, especially when you're on prednisone and you go from a slender face to a moon face. That's different. It's hard to look at yourself in the mirror sometimes. And with lupus nephritis, which is affected with the kidneys, you have swollen eyes or swollen eye pockets. And so the whole appearance and just seeing yourself differently, that affects you. It affects your personality, that affects your confidence, that affects how you feel people see you. And even though I have supportive family and friends, and people say, "Oh, you look fine," you know, don't say that. It's still hard to see yourself differently. So you just learn to adjust. When you're not feeling good, you tend to want to look like what you're going through. But sometimes you just have to force yourself, no matter what, to get up, put some clothes on, put a little makeup on, even though that's difficult. Put on some clothes, earrings, or whatever it is. Go get your hair done, get your nails done. Whatever it is that's going to make you feel better. That's what you should focus on. And don't be ashamed of what you see, even because sometimes I feel ashamed, especially with the fluid and things of that I see sometimes, and the swelling of my legs. When you don't see other people out there that's going through that, you feel ashamed. But it's comforting when you get around people that understand what you're going through. They may not know exactly what you're going through, but they understand. So just to get out and make yourself feel better.
It's changed my habits, and that has changed, like, my physical appearance and the way I feel and the way I present myself. A lot of that is underneath the clothes, so people won't always realize that who've known me for a while, unless they know me really well.
I know that if I have a flare-up that's significantly bad, you can actually see the swelling on the outside, and like you can see like the bruising, and it's really gross. With the work that I do, I help to train medical students, and they, you know, have to kind of like practice the physical exams on me. And I remember one time they got to the lung palpation exam, and I was flaring up and hadn't fully realized it yet. Like, I felt something, but it wasn't that bad, and so I was like, okay, you know, I only have like 2 more sessions after this, I can make it through that. And they like kept tapping on my back and like asking me, was I okay? Like every time they would walk behind me, and I'm like, what are you talking about? I'm fine. and there's a one-way mirror that's kind of like behind us at the time, and I remember catching a glimpse of myself, and my back was just like all purple and yellow and bruised, and I went, oh, that's why they were asking that question.
I'm definitely happier now than I was when I was accomplishing more, but my body doesn't look as good. To some extent, I'm like, that's okay. Do what you can when you can, and that's enough. Other times I'm like, oh, nothing looks good on me. Again, that's kind of appearance, like, because I just don't have as much energy as I would like to do the exercise I would like to be doing, or like the healthy sort of routine I would like to be doing. Me thinking about not even wanting to like check my appearance. It's like pajamas all the time sometimes, or like just a whatever outfit, because I'm not doing anything.
Appearance, that just the steroids themselves make my face puffier. I gain weight more easily because of the steroids and the other immunosuppressants. I've had some bad infections. The worst infection I had was in 2010. I ended up being out of work for 3 months. My doctor afterwards actually said, he was just so worried about me, and just looking at him, I could tell that he wasn't sure, I think if I would even make it, because I was in and out of the hospital so much, and I was becoming malnourished. I lost most of my hair just from not eating enough, and that's more from the antibiotics, which caused a lot of, this feeling of illness and not wanting to eat and living on popsicles, which is not a good thing. I know that. But it's hard to make yourself eat when nothing appeals to you. And that was, one of the hardest times in my life, I think, is going through that. And because of that, I ended up later, I didn't heal well from it, so I ended up with a very large hernia. That word always escapes me for some reason. And it's quite big, so just, after that, having to go to a store and try on a dress has been that's a struggle for me. Some days I could care less what I look like, and I forget it's there, and then if I have to, try to put something on that doesn't quite feel right, I, put a dress on and I feel like I look pregnant on my left side, something like that, and I can laugh about it. But it's also sometimes, you have those days where you're like, what, people do look at me. Kids more than adults. Adults should know better, I think, but they don't for the most part. And children I can deal with because they're younger, they don't know. And I prefer that a child would ask me, why I look a certain way or have something going on with me, so I can explain it to them in simple terms. And my grandchildren do. I every time I see my granddaughter, she asks me why I shake. Why do you shake, Grandma? And it's like, well, I have to explain to her it's my medication. And I think she knows the answer now, but she still asks me.
For probably about a year, when I was going through all the eye surgeries, I wasn't allowed to wear makeup. So I learned to like myself without makeup. Luckily, for about 4 of those months, I couldn't see myself. And I also remember after the stroke, I suppose I was in survival mode. But probably for about 2 months, I didn't want to fix up my hair or put on my makeup. I was just focused on getting better. Until one of the occupational therapy people gave me the homework of going home and blow drying my hair and making myself look, pretty. So, yeah, there's definitely a difference. And with me not being able to see as well, I can't do all the fancy makeup tips and everything. I just do all the simple stuff, and simple stuff with my hair. I try to oomph it up a little bit every once in a while, but it's definitely different.
So it's been a real challenge with just my identity. Just shifting into a place where I feel like I have to get to know a whole new person. Just kind of an identity overhaul, and then I felt like I'm this new person that I don't even really know. At the same time, I feel like there are seeds of myself that I know really well that haven't changed, and those have only become stronger amidst the chaos. So I feel like I've lost a lot of parts of myself and my habits and my lifestyle that I can't really regain. But at the same time, there are things like my spiritual practice and my values and my relationships that also make me who I am.
You have to find your source of comfort that's going to help you to rise above. So my rise above is reading the Bible, writing. I love to sing, so I'm a singer, so I sing. And I like to get out and support, and I like to educate people about what I'm going through, because I feel like if I educate people and I'm not so focused on myself, it helps me to heal in a sense, because you're not so focused on yourself. Join a support group, start a walk, start a foundation, whatever you feel like you can do just to give back. And I'm telling you, it gives you so much. It makes you feel so much better. It's hard, but it makes you feel so much better to take that first step.
I will get the YMCA with kids, and what I do is I play games around the hamster workout, and then we play games, and I just hang out with them, and stuff like that. And when they come back, they try it fun, and then they can go with the parents. So
I guess I always find ways to do things. I don't let things put me, down and sadness. I figure out ways, when my fiance said, well, how are we going to go to that concert? That's such a long walk. And I said, we'll get a wheelchair, and, other people do it. And so I'm of the philosophy of just take a hold of life and just manage it however you can, and just find fun wherever you can, and and just let people help you do things so that you can do those things and enjoy your life, because we all have to deal with something in our lives. And so I just am grateful that this is my lot that I have to deal with, and it's not anything worse. So I always just think of what I can do and not what I can't do.
I deal with it a little bit better now, but at first I was just really angry. Because, like, if you break an arm or a leg, you can put a cast on it. You can, avoid something touching a limb. What exacerbates this is breathing, and you can't avoid that. And so it's like the very thing that's keeping you alive is the thing that's causing you the most pain right now. And trying to sort that out in your head, it turns into a kind of just shoot me situation where mostly I try to remind myself that yes, it's kind of an important factor in who I am, but it is a factor of who I am. It is not the entire picture. I am not composed entirely of this thing. I try not to let it stop me from doing things. I try not to think of it as a limit. I don't know, I try to live as fully as I can even with it, you know. I try to think of it as, it doesn't mean that I can't do this thing I'm aiming to do. It just means I'm going to have to do it slightly differently than someone else. But if I can carry on and I can push through, you know, I have to step back and acknowledge that sometimes there are going to be accommodations that are going to have to be made, but I try not to let it, you know, flat out stop me. I'm gonna push through if I can, and it's life. You gotta deal, you know.
I try to wake up every day and just like I've said before, just do the best that I can at everything that I do.
My rule of thumb is that if I go to the when I have a doctor's appointment, and if they tell me that you need to change this, this, and this, or that, or whatever it is, I give myself that day to be mad at the world. But the next day, I do what the doctor says. I pick myself back up and I do what they tell me that I need to do. I educate people all the time. I actually volunteer at Mary Washington Hospital on the stroke wing with myself and a few other stroke survivors. And we go into stroke patients' rooms and educate them on stroke. I've also spoken at an EMS night on stroke. I've also role played for Stafford Hospital on what it's like to have a young stroke survivor, you know, in the room. Well, they weren't supposed to know that I was having a stroke, but to see if they could diagnose it, because the first hospital I was at did not. So I educate everywhere. I have little cards in my purse that on one side has all the risk factors, and then on the other side has a FAST acronym: face, arms, speech, and time. So I pass those out everywhere. Actually, a couple weeks ago, I passed one out to my Uber driver, and I've passed one out to my hairdresser, just everywhere, you know. The stroke coordinator asked me, you know, have you been passing them out? And every week it seems like I have something to tell her that I'm like, oh yeah, I've educated this person or that person. So I'm trying to get the word out, because stroke, I feel, is not as prevalent in education as, say, heart attack is. So it's a little bit more out there, but it's like any disease, it needs to be educated about.
The way I've risen above it is kind of seeing it as part of my story. And embracing that story and believing that it's there for a reason. As cheesy as that might sound, that maybe I'll be able to help other people with similar experiences someday. Maybe that will unfold and turn into something beautiful and new, that I wouldn't be able to do without this story.
Yeah, I mean, everybody's going to have their days, and you have to let yourself have those days. You know, I have days where I'm depressed, and it doesn't happen very often, but I'm able to see that that's what's going on with me, and I can get myself out of it. You know, and I can talk to people. I have great friends. Like I said, my parents, I'm very close to them, and I'm able to talk to my husband about it. So it works out. A good day is when you go on with your day, you feel good. An amazing day is when you forget that you have a disease. I always tell people you need to own it. You need to own your disease. You need to advocate for yourself. And when you're able to own it and make peace with it, you can move on with it.
going through a similar battle to your own. And I think that people can only become more empowered and have more of an impact towards changing things if they connect to each other. Again, as cheesy as it sounds, I feel like I would just want to tell anyone with a serious illness like this that they're not alone.
Look at me as a person, not just the disease. And when you're looking at a disease as a whole, you can't pigeonhole people into one thing because everyone's different. Everyone's got different things going on. Everyone handles it differently.
Just because you can't see it does not mean it's not real. And just because it's a pain or a symptom or an illness that you haven't experienced before does not make it invalid. And, you know, if someone is telling you, I'm in pain, or I need this from you, or they're asking you for help because they're telling you, I can't do this by myself, believe them and be there for them and support them and let them know that they have that hand to hold and that they have that help, because some days that's all you've got. So just try and be there.
There are a lot of people living with this. And I guess I only know that just because when you start, you know, expressing your own situation, your own shortcomings, or your own, you know, feelings of frustration or being in pain, you know, it's made me aware that there's so many people that are dealing with the same things, and that we all need to stick together and share our stories with each other so that we can share ideas with each other on how to overcome and to keep moving forward and, you know, fulfilling our dreams in life.
Just keep it a positive outlook on your life, because you only get one chance at life. So just act like do everything positive and you'll be fine.
Like, it's okay, stop apologizing.
Just because I'm a little different doesn't mean I'm not awesome.
Yeah. For one thing, just be supportive and try not to judge. It's hard, especially when you see someone that looks different, and or they may say, or someone with lupus may say that I have a flare up, or I'm tired, and they'll say, well, you don't look sick. So you have to watch what you say sometimes, because words can hurt. If I had to say something to someone out there that doesn't know about lupus, my thing would be just keep fighting. Be a fighter and be a warrior. There's a lot of us out there that's going through, if it's lupus, if it's diabetes, if it's cancer, whatever it is, just don't give up. Chronic illnesses affects everyone differently. And just for people just to be supportive and to love and show support and get out there and do what you can to help to educate, no matter what the disease is.
But I think the main thing is getting to know the person and being aware of the disease, and, you know, when someone tells you that they can't do something because of what's going on with them, or if they're tired, that just, you know, to accept it and be as accepting and loving and generous as you can be with your time and your life to help that person, I think is the best thing you can do.